Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. With me today is Dr. Bryn Henderson, and we're going to be talking about stroke. Every year, millions of people around the world suffer from something we often call a silent emergency. It can happen suddenly while you're cooking, walking, or even sleeping. And in just minutes, it can change your life forever. We're talking about stroke, one of the leading causes of death and disability globally. But what exactly is a stroke? Why does it happen? And more importantly, how can we prevent it or recover from it when it does happen and if it does happen to you or a loved one? Today, we're diving deep into the science and the human story behind stroke. From early signs to advanced regenerative therapies, from traditional treatments to promising breakthroughs, we're going to explore it all. And later in the show, we'll walk through the recovery journey of one remarkable patient who faced stroke head on and found hope in a whole person approach to healing. So, Dr. Henderson, welcome, and let's get to it. What is stroke?
That's a great place to start. A stroke is like a brain attack. There are types of stroke depending upon where they are in the brain. It happens when the blood flow to a part of the brain is suddenly blocked or when the blood vessel breaks. Since the brain depends on oxygen from blood, even a short pause in blood flow can cause damage. The most common type is ischemic, the lack of blood, where a clot blocks a blood vessel. Another type is atherosclerotic, which is caused by cholesterol plaque buildup. And the less common but often more dangerous type is hemorrhagic, where a blood vessel breaks and causes bleeding. Either way, the brain cells begin to die quickly, which is why a stroke is a medical emergency.
Why do we see some people that are a risk higher than other families, let's say? You have, as you practice medicine, we're talking to a patient, and they go, oh, my grandmother had a stroke, my grandfather had a stroke, my mother had a stroke, and I'm worried I'm going to have a stroke.
There are several reasons. Some of the major risk factors are things you can control, like blood pressure, smoking, diabetes, high cholesterol, obesity, and not exercising enough. Others we cannot change: our age, gender, family history, and ethnicity. For example, the risk goes up significantly after the age of 55, and African Americans and Hispanics tend to have higher stroke rates. A big one that people often overlook is atrial fibrillation, an irregular heartbeat that can lead to clots forming and traveling to the brain.
All right, so genetics do play a role.
Absolutely, yes. In fact, more than just people realize. Genetics influence how our bodies handle things like cholesterol, blood pressure, and blood clotting. If your parents had a stroke, you're more likely to have one too, especially if they had it at a younger age.
Well, this may surprise people, but can a stroke actually start before someone's born?
Absolutely, it can. The blood vessels begin forming in the womb. If something goes wrong during this development, like in cases of Moyamoya disease or arteriovenous malformations, it can lead to weak spots or abnormal connections in the brain's circulation. These structural problems can increase the risk of stroke even in children or young adults.
When I was in medical school, someone had what's called a Berry aneurysm and died from a stroke in their brain. That was a congenital thing. Do you know anything about the percentage of people that are born with a Berry aneurysm?
I don't know the exact percentage, but I can tell you this. Berry or any aneurysm is like a bleb on a tire.
Oh,
And so if it's a malformation, it either has to be fixed or controlled. And one of the ways to control it is to make sure that blood pressure is controlled.
okay. So let's talk about symptoms. If someone is having a stroke, how can you tell?
Oh, you look at additional symptoms. It's FAST plus the additional symptoms, but the face is used because we ask them to smile. And if you have one side that's drooping, then that's not good.
Mm.
And A is for arms. You ask them to raise both their arms. And if one drifts down a little bit, it's a good likelihood we better find out why that is. S is for speech, and often it's slurred. And T is for time. And if you have any of these, call emergency. Get
Okay.
help immediately.
Let's go over that again, because a lot of times I'll have a patient that comes in and the older woman or man is living in the home with the child who's an adult now. And they'll say, I went in there and my mother she was slurring her words and half of her face looked weird. But now you're saying they could say, lift up your arms
Or smile.
or smile. All right. And then get to an ER fast. Tell us about the injection that they can give if the stroke happens and you get to an ER and you get that injection. You have a good chance of having that clot thinned.
Absolutely. Actually can be dissolved. You use what they call TPA, and that thins the blood. If it's given within 4 hours from when the symptoms start, patients have a good likelihood of recovering from a stroke.
Okay, so if someone is like a candidate that they're going to have a stroke, they know their father had a stroke, they know their grandmother had a stroke, and they're going, oh boy, I'm in line. Can't they have something that they have at home that they could take? I've heard a lot of people, they say, take an aspirin to thin your blood, or would that work?
Yes, it helps.
Helps.
But what you're really wanting to do is get their blood pressure taken, see what it is.
Uh-huh.
And for bleeding strokes, in other words, there's only really 2 types. One's when you stop the bleeding, and that's because of ischemia. Again, there's a lack of blood supply. And the other is you hemorrhage or bleed. Both are wild and dangerous. And the latter, the lack of blood supply, is by far and away the larger of the problems. 80% of all strokes are due to the clot, the lack of blood supply. Every minute counts.
Interesting. So in review, there's 2 types. One, it's like a kink in the hose and no blood is going through. And the other one is the hose is on full blast, right?
Sure is.
All right. Let's go to a case you've been working on. Tell us about your patient.
Well, this patient was an 80-year-old man, and he came in for a follow-up after a stroke. He had ongoing issues like facial weakness and dizziness, fatigue, and even emotional ups and downs. Over several weeks, we helped him with stress management, hydration, and mobility exercises. Then we moved into more advanced treatments like IV therapy, regenerative medicine to support the brain healing.
Okay, so what kind of regenerative medicine therapies did he get?
Well, the first thing we were able to do was we were able to do a brain map on him and see how extensive the injury was and where it had occurred.
Wait a minute, this is new to the audience. What's a brain map?
Well, it's called an electroencephalogram. An electroencephalogram monitors the electrical activity of your brain. It's fantastic because it tells us about brain function, not just anatomical. It's how well it's working. And we are able to help restore the cells that have been damaged. Usually it takes a couple of week protocol, 2-week protocol, that includes exosomes and peptides and sometimes regenerative cells to protect that brain and boost recovery. We also use the peptide acetylcholine, or the more comprehensive is the cerebrolysin. These help support nerve cells and brain communication. And to top it off, we give nutritional support through the infusions, the IVs, and monitors physical progress with the kinesiology or the physical therapist. Over time, we saw many, many improvements in mood, speech, and strength.
Before we go into more complementary therapies, I want to go back to the cerebral lysin and the other one you mentioned. What was the other one?
Citicoline.
Citicoline. So what about a patient who goes, I don't want to end up with a stroke. Can I get this citicoline and the cerebral lysin now? I don't want to end up with Alzheimer's. I don't want to end up with memory loss. I don't want to be fumbling around.
Both of those are available since they're peptides. Those are proteins that are connected with special bonds, and they're in our bodies anyway. It's just that we don't have enough of them. So it is true, you can have those administered. Most are administered with some kind of an injection, so they work faster, and they can either be subcutaneous or in a muscle.
Okay, so what about acupuncture?
Acupuncture is really about balance. It reduces spasticity, improves your balance, and enhances motor recovery. There's growing research that boosts blood flow to the brain and encourages nerve healing through acupuncture. So for some stroke survivors, it can make a real difference in rehab.
Okay, so you mentioned peptides. This is a new word in America, I can assure you. People are just starting to hear it, and they're going, what is a peptide, and can it help a stroke?
Well, peptides absolutely can help. Peptides like thymosin beta-4 help the brain heal by supporting nerve growth and reducing inflammation. Others reduce scarring in the brain and help nerve connections grow. There are even arginine-rich peptides that protect the brain cells right after a stroke. The idea is to give the brain better tools to repair itself.
All right, so what about this new technique called vagus nerve stimulation that I've heard about?
And that's an exciting development. And the vagus nerve is probably the mother lode of nerves. It controls more facets of our lives than most people are ever aware of. It sends these small signals to the brain during physical therapy and helps the brain relearn how to move, especially the arms and the hands. One FDA-approved study showed that people made better progress in rehab when they used vagal stimulation. It works by boosting the brain's ability to form new connections.
Wow. All right, so we've talked about a lot of therapies. You mentioned physical therapy. How does physical therapy work with stroke recovery? I mean, I get it. You're learning to re-walk and balance and coordinate. But is it something like chiropractor? Now, when I go to a chiropractor and they adjust me, I get those endorphins. Is that what happens with physical therapy?
Physical therapy is the backbone of stroke recovery.
Yeah.
It helps patients relearn walking, balance, coordination, and the fine motor movements, like using a fork, brushing your hair. Therapists also work to prevent complications, like the muscle tightness or falls. Consistency is the key. The more they practice, the more the brain adapts and recovers.
All right. So let's say someone has a stroke, they're in the hospital, they've gotten the physical therapy, they've changed their lifestyle, they finally quit smoking or cut back on drinking, and they're doing the latest and greatest innovative peptides and exosomes and stem cells. What's a plan for these patients?
We follow a very structured plan. Patients usually come back for a checkup within days, and often within 1 to 3 weeks, there'll be multiple visits. Then at 3 months and 6 months, we don't just drop them off the bat.
Mm-hmm.
We monitor their blood pressure, blood sugar, cholesterol, and emotional health. We also check for problems like depression, memory loss, even difficulty swallowing. Rehab doesn't end at discharge. Some of us, it's lifelong.
Have you ever seen anybody that got back their normal life after a stroke?
Absolutely. In fact, in our office, we found many patients that regain all of their independence. They go back to work and back to their hobbies. They go back to normal. And that's because they manage their risks, stay active in therapy, even if at home. They build a strong support system at home. Stroke recovery is a team effort. And we've seen patients do remarkable things.
All right. So what do you want people to remember about stroke? What's the key?
I think stroke is best remembered with a mnemonic stroke. Starts off with stop smoke.
Yeah.
Yeah, can you imagine, right?
And vaping.
Oh, yeah. So S is for stop smoking and T is for take your medicines. Another easy thing to do, but it's also common to forget. R is for reducing alcohol. Drink in moderation, if at all. O is optimize your diet. We talked about the various types of diet. The low salt, add the fiber and the vegetables. And K, we're getting close. K is keep moving. Keeping moving is physical activity. Even walking lightly helps. E is educate and monitor. Know your numbers, your blood pressure, your cholesterol, and follow up with your doctor regularly. These steps can help reduce, protect the brain, and support recovery.
Thank you so much for being with us today on Doctor to Doctor, and I hope the audience has benefited from it. If you would like more information about products that you can use that are natural supplements that will help you keep your arteries clean, keep yourself at least being proactive to not have a stroke, please go to my website at www.askdrhelen.com. That's askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.